Hey everybody, it's Susan Lindner. I'm your host of the Innovation Storyteller Show. And today is going to be fascinating because I think you're going to hear things that you never thought you'd hear from a healthcare institution before. We're going to be talking about innovation, certainly. We're going to be talking about new and exciting ways that social movements are transforming healthcare. And we're going to look at new ways that physicians and the entire healthcare ecosystem is getting involved in patient care. So I'm beyond thrilled to have with me today Sheila Phicil, who is a first-generation Haitian American whose mission is to be a transformative leader who accelerates change and innovation. Her first leadership role was founding the nonprofit organization Children in Action at the tender age of 12, which was aimed at engaging youth in her community to pursue their gifts regardless of their age. Her aspirations led her to a career in healthcare administration, and she's completed 2 graduate degrees at Boston University, a master's degree in public health and a master's in financial economics. And she is a certified project management professional with more than 10 years of experience in healthcare, spanning policy, strategy, and operations. She has been the director of oncology and inpatient operations at Dana-Farber's Brigham and Women's Cancer Center, and also worked at the Center for Innovation in Social Work and Health at Boston University. Sheila is currently the director of innovation at the Boston Medical Center and its Health Equity Accelerator. Sheila, thank you so much for joining me today.
Thank you, Susan. I'm so happy to be with you.
So we are going to be talking about a whole manner of things today, Sheila, most of which is, well, starting with, how'd you get here? How did you begin to get into this role of healthcare innovation?
Good question. And part of the reason why I include that I'm a first-generation Haitian American in my bio is, as most first-generation people know, your parents often push you to kind of one of 2 career paths, either become a doctor or a lawyer. And my parents obviously really wanted me to be a doctor, and I was actually quite in love with healthcare. I was a healthcare volunteer at a very young age, pre-med. In college, I wanted to go into rehab medicine. I definitely felt like that was the thing for me. And it was actually an experience traveling with a medical team to Haiti. This was actually before the earthquake, where we were providing rehab medicine in Port-au-Prince and surrounding areas. And this was a team of very skilled professionals bringing high-tech equipment for patients who needed artificial limbs, casts, walkers, you name it, they were able to do it. And it was interesting that within a week of being there, patients who were traveling obviously from very long distances to get care would come back and return a lot of the items that they were being given. And of course, the team was really dumbfounded by this. We're, putting all this work into this, what's happening here? Thankfully, I speak the language. I was talking with the patients and trying to understand from them, why are you bringing these things back? This is to help you. And they would say, I have to cross a river and I can't get it wet. Or, I need to be able to keep this item clean and I don't have, running water. And I just remember being a light bulb went off, oh my God, we didn't really take into account how these people were living, what their situation was like, to provide them care that was applicable to their current living situation. And it was just a moment for me where I was you know what, I think I really want to make sure that my career in healthcare really looks at the upstream factors, looks at the system of how we're providing care, and takes into effect people's current living situation, so that we're doing it right the first time.
Yes, so critical, right?
Mm-hmm.
We just think we come up with a clinical solution and everything will magically work around the patient's life without ever inquiring, what is the patient's life like? Right?
Exactly.
Yes. So, you and I share this love of public health. That was certainly my career path, my first 10 years out of college. And it's that really deep diving as an anthropologist, it's this ethnographic inquiry, but it's also this appreciative inquiry. Tell me about the problems also, not just the strengths of what's working, but tell me about the problems that you face on the day to day, so we can build a solution around that. So
Exactly.
you're in Haiti and you're working on these challenges, and then what came next?
Well, at that point, I decided to make a career change. Rather than going into medicine, I went down the path of public health. I ended up going to the Boston University School of Public Health, where I got my master's degree and just kind of started my career there. My first job in the field was as a research assistant, working on helping communities at the time that were dealing with HIV and AIDS build peer-based interventions, and also worked on children, policy issues for children with special healthcare needs. It was a lot of doing training, working with like state and local organizations. So that's where I got kind of like my introduction into public health, and more importantly, working with communities that were particularly vulnerable. And it was an interesting time to start in public health because I started my career around like 2008, 2009, and that's when around the time when, Affordable Care Act passed. So like, unpacking that and what that meant for large portions of population that were just now getting access to care was also an interesting time.
Yeah. Um, and so that development coming back and saying, okay, I'm going to wind up studying public health, but then you went on to get a finance degree.
Yes. So I always was curious about how money moves, why it moves the way it does. And it was just always a curiosity of mine. And I didn't really feel like I got that from my public health background. So my master's in finance I was like learning about like bonds and like how companies are valued. And I thought it was really important for me to understand the language of how money moves, how it gets made, how economies form, because that is like the macro system, right, that we're all operating in is capitalism. So you have to understand how it works, so that you know kind of where to put your focus when you're making interventions. Now, and where that connects with healthcare, we'll talk a little bit more about that, I think is really around economic mobility, right? And when you can understand how the engines work, making sure that everyone has access to those opportunities is really important.
Absolutely. So now you're working, at Boston Medical Center, and you're beginning to work with startups, right? There's certainly an economic incentive in working around these startups, but tell us a little bit about this role and what you're working on and what you hope to accomplish there.
Yeah, so Boston Medical Center has been in the space of serving vulnerable populations since its inception back in like the 1800s, when it was Boston City Hospital. It was the first public hospital in the United States, and had since grown and merged with other institutions to become Boston Medical Center. And we're now a health system that includes a health plan. The organization was established to really meet the needs of the folks that were at the time living at the lowest income level. And the Boston demographics really changed since the 1850s. So we have a large portion of Black, Hispanic, Latino, lots of different migrant populations, lots of different languages that are spoken. And our mission is to provide exceptional care without exception. And we do that with a lot of rigor and grace, despite being, a safety net hospital, the largest actually in New England. And from the work that we've done with the patients, there's a lot of initiatives that came around to looking directly at health equity. We have, our pediatricians set up a child tax credit initiative where they're helping parents apply for those benefits. We have a food pantry. We have done work in the community to help prevent violence. But it was really COVID and a lot of the attention that got paid to Black Lives Matter following George Floyd's death that really kind of made the institution step back. Like, despite having decades of experience in this work, it became clear that there was still work to do, particularly around racial disparities in the work in terms of like taking care of the clinical needs of our patients. So it was probably about a year in the making, and then the Health Equity Accelerator was established in November of 2021. It's led by Elena Mendez Escobar, who's executive director, as well as Dr. Thea James, who is a veteran and advocate for health equity as well. And I'm actually fairly new to the team, only in the last 4 months. But the work that we're doing is taking the energy and focus that Boston Medical Center has had around health equity and really to accelerate it, break silos, look very intentionally at the issues that we're seeing in terms of the gaps and really interrogating the process. What are we doing differently for our Black or Hispanic patients that is causing disparities in health outcomes? What system issues could we really tackle to make sure that the patient's basic needs are being met? A big component of this is looking at social determinants of health. Our hospital has been doing this for many years now and continuing to evolve in that space in terms of understanding food insecurity, housing insecurity, and other issues that prevent patients from living their best lives.
It's fascinating to me, right? I mean, we were speaking just before hitting record on this session of how often we forget to look at the totality of the patient who comes, through the doors of a health center to really understand what's going on. And, I can still recall working, with sex workers and their customers in Northern Thailand and, asking them like, what would it take to get you to leave the profession essentially? And the answer was, well, what could I do that would be equally as lucrative, that would help me support my family?
Mm-hmm.
And so, we didn't want to come up with the answer. We wanted them to tell us, what is it that they wanted to be doing? And the answer turned out to be entrepreneurship. These women wanted to start their own businesses and be able to thrive on their own without being encumbered by any boss again, ever. And so that's what we did. Like the way out of HIV transmission and dangerous sex work was entrepreneurship. And so I'm curious what you found in your work were the ways to really support people through their economic difficulties and social difficulties.
That is a great question. So I talked about like the social determinants of health. Boston Medical Center, it is part of what we do, particularly in our primary care populations, to ask patients about
shocking. What? Ask
how much food do you have at home? Are you having
and the other really compelling part, right, is listening for the answer. Right?
Yes. Listen for the
how
answer.
many times, right? There's lots of surveys and no one actually even looks at the outcome.
Absolutely. And once you ask patients, they're able to really tell you what their needs are. And what they prioritize as their needs as well. Like, it's really up to them to decide, like, this is the thing that I want to tackle first. And I mean, this again is a space that we're continuing to evolve, but we're asking these questions. We're tracking it over time. We're being intentional about connecting patients to resources as well, so that they can get the help that they're looking for. And we're also engaging the community and helping us think about what programs and interventions would work best. So, and we really got a great opportunity to do this on a broader scale during COVID. And as you know, COVID disproportionately affected communities of color. And Boston Medical Center, I think we were maybe like the second wave, we were hit really bad, right? And our beds were full. And, it was really an opportunity for us to like take a step back and think about what we were doing for our patients in terms of making sure their needs are being met. And the disparities, even around like the COVID vaccine, really taught us a lesson, because as soon as the vaccine came out, we saw that communities of colors were not getting vaccinated at the same rate as white communities. And what was interesting, it wasn't something we were just seeing in the community. We saw it within our own hospital. My prior role before being in this innovation role was as a director of a department. So I had a team, over 200 like staff that were reporting to me in various capacities. And, you could see the statistics, and it really took asking the question, like, what is the reason for the hesitation? And obviously there's, it's been well talked about now, like the history of how Black people in particular in this country have not been treated well by our research and scientific institutions, but we needed to understand what questions did they need answered, and we needed to understand who were the right people to deliver those messages. We have a fantastic community engagement department led by Patrina Martin-Cherry, who's our Vice President of Community Engagement and External Affairs. She had connections in the community. I describe her as a super influencer because she got she got the right people that to join BMC in delivering the message to the community so that we could engage around the vaccine. And we're continuing to learn from that process, like how to incorporate the patient's voice, how to incorporate the voice of the community so that they can guide the work that we're doing. So to your point, yes, ask people. They will often tell you exactly what they need to get the results that they're looking for.
Yeah, and the response was fascinating because I recall hearing people say, why are they putting all the vaccine centers in the Bronx? Here in New York? Why are they putting all these vaccine centers in Harlem and Brooklyn? And it was such a head scratcher to me that people didn't realize that communities of color were being disproportionately affected by COVID. And they really thought that this was an even-handed pandemic. And I don't know how you felt about it, but it seemed like the media, it took them a very long time to make that connection between social standing and access to care for some people versus those who were, frankly, in the majority.
Yes, that is a great point. And what I think is, I think a missed opportunity a little bit with the COVID pandemic was really helping to tell the story of just how the system is designed to be unequal in terms of the results that people produce and the way people live, right? One of my favorite quotes is, every system is perfectly designed to get the results that it gets. So our healthcare system, our socioeconomic system is designed in a way that Black, Brown, minoritized communities don't get access to the same resources and tools that would enable them to thrive. It is just an unfortunate fact about our society. And so because of that, to achieve real equity, to get everyone on the even playing field, you have to devote more resources or more attention or different pathways for those communities to achieve the same results, right?
Parity.
I think a lot of people have seen that graphic. It became a meme, I think, at some point, of the three boys that are looking over the fence at the ball game, and they each had different stools or boxes that they were standing on. And to get to the equity, but I know someone has also mentioned, I think a different spin on that was like, well, just remove the fence. Then regardless of your height, you'd be able to see, right? So it's getting to some of those root cause issues. And I think sometimes the reaction to that is, well, then you're preferentially treating another population based on race, and that contributing to the same issue. But we know this, and there's a lot of data out there, and statistics are not my thing, so I couldn't talk about them at the top of my head, that when we do better for the least of us, it lifts everybody. So when your Black mom can go into a hospital and deliver a healthy baby, that ensures that all moms can go into the hospital and deliver a healthy baby, because the system then is designed to work for the most vulnerable person so that it helps everybody. And that's what it's about. And that's certainly what BMC is working towards.
So we had also talked about social issues really impacting healthcare outcomes. And I think as innovators, sometimes we forget, we get a little bit insular, focusing on this breakthrough idea, this big change that we want to enact, whether it's incremental or some giant moonshot. But we can become really insulated from what's going on the street and what's happening in the day-to-day lives of our consumers, who will eventually be impacted by the innovation we bring them. And so you had this double whammy of being in healthcare and especially serving BIPOC communities, striving to bring equity to them, of getting hit with COVID, lockdown and then the George Floyd protests that were going on in 2020 and how that was impacting individuals, but also whole communities. Can you talk a little bit about what it is to be an innovator and to be conscious of the social construct going on just outside your door?
Yeah, that is a very complex question.
Yes,
So
it is.
I'll comment on the innovation piece first. So there's some innovation that brings us things that we didn't know we need, right? Like cars, planes, cell phones, AirPods, right? There's other innovation, which is the kind that I want to be better at and strive to be good at, which is innovating and solving problems that really require looking at systems and processes that sustain those problems, right? And to do that effectively, you have to look at it critically, you have to break it open, you need data, you need transparency, and then you need to decide to act, whether you're going to redesign the system or reimagine it. And oftentimes the starting point is with stories, right? And you're really good at this. We have to connect people at the heart level so that they understand what's at stake, they understand the level of urgency. And I think really that's what the George Floyd murder showed us, right? Like no one could look away and deny that this was wrong and it shouldn't have happened. And then it forced us all to take a deep breath and like, wow, like where else is this happening and what can we do about it? But bringing people along with stories and how it affects individuals is really important. And one important way that I did this was by sharing the impact of racism for myself with my community, which was at the time a department that I was helping lead in my prior role overseeing the Department of Neurology. I shared a story of like my own experience with racism and how it affected me, and really tried to make it palpable. Like when we see stories of Black women and Black men not living past the age of like 25, or being singled out, or disproportionately locked up, or whatever it is. I mean, most Black people, we don't see ourselves as separate from that. Like I could have been a Breonna Taylor, right? My brother could have been George Floyd. Nothing about my privilege, which I consider myself as someone with privilege. Like I'm well educated. I have a good career, and I'm able to take care of myself. That despite that, the results could be very different for me just because of my skin color. That's it. It doesn't matter, how well off I am, what community I live in, who I'm connected with. And when telling that story, I think people were like, whoa, wow, that I didn't realize that it was that close to me. Like I see you every day. And it really forced people to take a step back and understand that this issue really does have to be dealt with because it affects people's everyday lives.
So how does that in turn impact the innovations that you're thinking of?
So I think when it comes to innovation, it's not as much about thinking outside of the box or bringing in fancy new technology. To me, I think the core of what we're doing in healthcare is building trust, right? It starts with communities opening up to us and telling us about what's important to them. It starts with us really listening and understanding their needs from their lived experiences. And then it's working with the community to build the solution. And anything that we've done at BMC that has been successful, it's because we did it with the community. Their voice was involved. They helped shape it. They helped guide it. They help tweak it. And it's because of that it's able then to be successful. And it requires a lot of humility to hear things that are often uncomfortable. But we strive to do that every day. And it's in doing that we're willing to take the risks and invest in the programs. And like I've mentioned, BMC is a safety net hospital. We're not making hand over fist on the patients that are walking through our doors. Like it's really, sheer force of will and, piecing together funding sources, often grant-based initiatives, to carry out these programs that our patients find very valuable.
So is it fair to say then that the projects that have succeeded are the ones where you've involved the community? Are there projects that have failed because you didn't listen to the community?
Certainly, and we've had to make changes to things based on the feedback we've heard from the community. So we have developed a social needs screener, as I've mentioned, where we ask patients about, food, housing, and other things. And one of the important ways that this showed up, like we had a question about asking patients what their level of education is. The point of this question was to then get them access to resources that might get them a higher education. And it was talking to patients that they told us, like, well, that's offensive. Don't ask me my level of education. Just ask me what I want in terms of education. And that's where we were able to make the change and ask the question in a very culturally appropriate way. And again, actually, I don't think I mentioned this, but Boston Medical Center, we serve a very diverse population. 60% of our patients are Black or Hispanic.
Wow.
50% live below the federal poverty line for a family of 3. 30% use a primary language other than English. We serve over 160 languages, so very diverse community of patients. So we had to make those changes and adapt to the needs of our patients and what they felt was the best way to reach them.
Wow. I mean, it's UN week here, right? It's the UN General Assembly week here and UN Climate Week. So I just think about all those translators sitting at the UN and you have to do it on the fly where potentially people are like bleeding out the head, and still managing that. So that's a fantastic question. And I remember in my work with the CDC, and tracking all the different strains of HIV that were coming into the United States back in the 90s. And we had questions too. And it came up again during the monkeypox epidemic that's been going on, and New York has been hit quite hard by it. And it surfaced on the news. I was watching it the other day, the same question we had from almost 30 years ago, using the phrase men having sex with men, as opposed to saying, are you gay, straight, bisexual, etc. And it's because so many people who are men who have sex with men don't think of themselves as gay or bisexual, that we say it that way. And by the way, lots of testing has shown that answering that question is much easier than actually labeling oneself with a particular label. So there was a lot of questions like, oh, why are they doing that? Why don't they just say it? And it's because, lots of people who have been in the field have found that that's how you actually get to an answer that helps people, as opposed to just making it easier for the majority to label people, right? Which are two very different things. Like to your point about, do we want to just test how educated people are versus do we really want to help people?
Exactly.
So, I'm really intrigued, Sheila, by this background of yours, and I'm seeing this beautiful garden. I'm taking it, this is not your home.
No, this is actually the rooftop garden at Boston Medical Center. It's like, if you didn't think a hospital could grow its own food, we're doing it. And the things that we grow in the rooftop garden feed our patients. We have a food pantry. We teach classes. We teach people how to cook food, and we try to incorporate very diverse cuisine as well. When I tell you we're innovating, we really are. Like we're going into spaces that you wouldn't typically think a hospital operates in, but this is healthcare, right? People having access to food is good healthcare.
Or well care, right? Not even just, not always just curing something, but keeping people healthy.
Exactly.
And to this point, I think this is where Dr. Fauci had an opportunity to truly transform America during COVID. And he was my boss during, when I was doing AIDS research, and he was someone we admired very much. But rather than becoming experts in creating, in baking beautiful sourdough bread and decadent brownies and lots of amazing mac and cheese recipes that were being shared across the internet and, on television, it would have been to say, America, this is the time to get in shape. That obesity is part of the epidemic, and we're not asking you to buy anything. No need to necessarily invest in a Peloton, right? Just move. while you're in quarantine, while you're home, get on the floor and do yoga with your kids, like get up
Yeah,
and, do jumping jacks, run in circles, go up and down your staircase in your apartment building, right? It
yeah,
could have been a national movement for movement in this
it could
country.
have.
And I feel like we missed that opportunity for wellness as opposed to just endless discussion about the vaccine.
Yeah, we're looking at this right now through our Health Equity Accelerator. We are intentional about focusing on clinical areas where we're seeing wide gaps and racial disparities, and chronic conditions like diabetes is an area that we're looking at. And we know that exercise and nutrition, some of the most simplest lifestyle changes can really prevent someone from going from being pre-diabetic to diabetic. And we want to innovate in that space. We want to make it easier for patients to get access to that kind of care, and taking those small steps to take care of themselves, but also making sure that we're conscious of the barriers that exist in communities in terms of like access even to just parks, or there's a lot of people that live in food deserts where they don't have access to healthy food. So it's really important that we're not just targeting the individual, but we're looking at the community and the environment that they live in and making sure that it's conducive to healthy living.
Yeah, I was living in Newark, New Jersey, right, which is pretty, it's, very racially diverse, very ethnically diverse, but there certainly are parks. But when I would go for a walk in the middle of lockdown, the only people I would see on the street were first responders who were trying to get to their jobs, and people with mental health issues who were on the street, and people who were using and abusing drugs. And so it also just became like a little bit fraught about, where do I go for a walk? In communities where it isn't always necessarily safe to just get out there and go for a walk. Like it's really not always that easy. So
Exactly.
yeah, I certainly felt that. No diss to Newark, but it certainly was a question about like choosing my route, and making sure, as it got dark, getting home safely. So
Absolutely.
so tell us a little bit now more about the accelerator itself. So you are looking at businesses, investing in businesses. Is this like, most people think about an accelerator and there's a venture capital model down the block that's about to happen. Tell us about what is this
So
model?
I think what's different about the way we use the term accelerator is we're really about breaking silos. So, as you know, healthcare we're very good at being siloed. And Boston Medical Center is an academic medical institution. So we have a teaching mission, we have a research mission, and a clinical care mission. And we do advocacy work as well. So our job really is to break the silos and the walls between those groups and get them to like all work together, and those functions to kind of row in the same direction, so that when we identify needs and opportunities to help our patients, we're able to put the full force of all of the energy and access and resources that we have towards breaking those barriers. And that's where the innovation happens. And do startups and other companies have a role to play? Absolutely. We're always looking for interesting partnerships. In our equity and pregnancy program, we're developing a chatbot to engage moms while they're going through their journey, right? So there's definitely a role for technology to play, but we're starting with marshaling our resources and making sure that we're throwing everything that we have at the problem, right? Because there's actually quite a bit that we can do in terms of like breaking barriers and moving the system forward.
I don't know if I'm stepping out of line here, but I feel like that the more women that get involved in the innovation space, the more desire there is for holistic integration around a great idea or movement forward. It's this sense of saying, I'm not the guy with the cape. I'm not the superhero here necessarily. It actually does take a village in order to make a movement. And therefore, we all have to be in it together in order to achieve the outcome that we're looking for. It's not going to be one iPhone, one app, one thing that necessarily does it. It rather is a much harder task of collaboration and integration that can push innovation forward. What do you think about that? Is the feminization of innovation part of this process, or am I totally off base?
I mean, I think you're definitely onto something where I think we're seeing more, and certainly in my career, I've seen much more women stepping into leadership roles. Like our president of Boston Medical Center is a fantastic woman, Kate Walsh, one of the most personable human beings I've ever met. And she is so passionate, like she's like dripping with passion. But I think the power comes from diversity. When you have men and women, when you have people of all races and backgrounds and lived experiences and languages working together, the value of all the different ideas and angles and perspective that you get, you can't beat that. And that's one of the things that, I hold very near and dear to my heart. I'm always looking for who's not at the table. Even when I'm in a room of all women, I'm like, where's the men? Where's the men? Because the balance of perspective is so important. And it just, it creates such a nice like incubator in ways for us to make sure that the ideas that we're bringing forward really will stand the test of time. And I think that's what's also fabulous about America and the opportunity. Like this is a human experiment, right? There's no other nation on the world that has this many different people from so many different backgrounds and languages. We don't have, other really nations to look at as an example. We are it. America is it. And if we can really figure this out in terms of like how to draw on the strengths of all of our communities, people of all lived experiences, I think it just makes us better. And it doesn't mean that my experience is any more or less valuable than any others. It just adds a piece to the puzzle that makes everyone better when we're able to incorporate that in the way that we're thinking.
Yeah, it takes all the facets of a diamond to shine.
Absolutely.
Yeah. Okay. So Sheila, it's my turn to put you on the hot seat now. So I want to ask you if you had the opportunity, well, let me ask you this, greatest innovation of all time. What do you think?
Oof.
Since the course of human history.
Wow, that is a hot seat question. I have to say the airplane. Maybe it's because I've just been on planes so much recently. And the reason why also is I think the airline industry is a very good example of you have to get it perfect every time. No one would get on planes if like 5% of the time the plane's going to fall out of the sky. The airline industry, they've worked out the kinks, right? And think about everything that can go wrong. Like I've had to travel from Orlando to New York and there was a thunderstorm and it was like, there's so many variables and things that you can't expect and workforce issues, but somehow the planes get in the air and then they land. And it takes a team. It's so much systems and redundancies that I think other areas, and particularly in healthcare, we can learn from that. If we can deliver that same quality for every human being that's going, like, let's ensure they have the best lived experience. And that failures and setbacks don't hold people back. I think, we'd obviously be in a better world. So yes, I love the airline industry, especially because I can just close my eyes and fall asleep on a plane and not have to worry about whether I'm gonna wake up.
Right. Yeah. At the pearly gates, you mean, but yeah.
Exactly.
Okay. Fantastic. Innovation team you wish you could join if you had the opportunity throughout the course of human history. Which team would you have loved to have been on and bring some cool innovation to life?
Oh, that's a good question too. So this was a failed experiment, but if you probably remember, there was a big collaboration with JP Morgan, Amazon, and Berkshire Hathaway, creating this like healthcare thing called Haven, I think it was called. It didn't last long. It kind of came and went, and I was so excited about it. But I would have loved to have like been there or been a fly on the wall or like understood like what happened, why didn't it achieve the results I think it probably could have. But I think it also goes to tell you like just how hard it is to change healthcare. And I mean, and Amazon is obviously still in that space and still making strides towards really improving access to care and things like that. But that's a team that I would have loved to have been part of. Yeah.
Well, if there's anybody out there listening from JP Morgan or Berkshire Hathaway or Amazon on why Haven failed, we would love to have you on to talk about it, and see if we can, bring in some new ideas. Fantastic. And then something that really annoys you, or something that you really would love to see created or transformed or innovated in the future. Is there something that drives you crazy that you would love to see fixed, or something that you absolutely love that you'd love to just see in the world?
The first thing that comes to mind is education. I mean, and I think there's been a lot of conversation around like student loan forgiveness and other things, and just how much it costs to get a high quality education, particularly in America. I'd love to see more innovation in that space. In some industries, I think it's happening by default, right? Like tech industries that can't find enough programmers, they're just creating boot camps and very accessible training for people that are just, just have a college, high school level education. Mm-hmm. And they're starting at jobs that are very well paid, very high skilled. I think there's, the apprenticeship model is one that we should really consider more as well, because there's a lot. I mean, I know most of my skills I learned on the job, quite frankly. And a lot of what I learned in grad school, a lot of it, maybe I could have just Googled. So I'd love to see innovation in education so that it's much more accessible and affordable, because it is the master key, right, to unlock all kinds of opportunities for people. And I'd love that to be more accessible.
Yes. And showing them how to turn that, even if you do get a college education, the vast opportunity that's available to you with that education, right? As opposed to, I was a psych major, therefore I have to become a psychologist or a psychiatrist, exactly. Right? Yeah. Not even understanding, what an organizational psychologist might be, or, mm-hmm. all the other ways that you could be using that brilliant degree, says the woman with the anthropology and religion degrees, right? Yes. And yet I use both. But you've made
good use of them.
That's right. That's right. Well, Sheila Phicil, I'm so glad that you could join us today. If people want to learn more about what you're doing at Boston Health Center, how should they learn more?
Sure. We do have a website. You can find us on Boston Medical Center, and you can always follow me on LinkedIn. I'm constantly posting about my topics that I'm very passionate about, including health equity, and certainly you can follow Boston Medical Center on various social media channels as well to keep up with what we're doing.
Right. And go to Boston Medical Center if you want a salad that comes directly from the rooftop. Yes. Fantastic. Okay. Sheila, thank you so much for joining me. I really appreciate it.
Thank you for having me.